and welcome to our COVID-19 update, where we'll be speaking to the Minister of Health, the Honorable Dr. Frank Anthony. Hello, Minister, and thank you for having us today. So let's just jump right into it. On Saturday, I know the Ministry of Health would have had a vaccination drive-through at the National Stadium. Can you tell us what the response was like on Saturday?
I think we had a very good response. From the time we opened the gates to the stadium, we had a steady flow of cars coming in, and we were able to do 931 first doses and 140 second doses. So I think it was one of those sites where we had the highest yield of people coming in and getting vaccinated. So I think that people like the idea of being able to drive up. It's very comfortable. You're in the comfort of your own vehicle. And the staff was very proactive in making sure that people felt comfortable. They got the information, then they moved to the next station and they got their vaccines and they waited for the 15 minutes. We also were able to accommodate those who wanted to walk in. And I think that went well as can be. And so I think from the analysis that was done by the technical staff of the ministry, they felt that this is a very good way of getting people to come out and get their vaccines. And so because of that, on Wednesday, Independence Day, we are going to have another session at the stadium starting from 9 in the morning, and we'll go until 5. We wouldn't go till 9 like the last time, but until 5. So hopefully we can encourage people to come out and get their vaccines.
Right. Minister, can you say from which areas specifically persons came from?
We've seen people from Region 3 coming over. We got a lot of people from the East Bank. We had people from Georgetown who drove down. So people came from predominantly Region 4 and 3, which was good.
And since this has been a success, can we expect to see similar initiatives in other regions across the country?
Well, we're going to repeat it on Wednesday. And I know some of the other regional health officers in other regions have been contemplating doing similar or variations of this initiative. I think Region 6 this week is going to set up a drive-through by the Barbies River Bridge, so people can go there and get their vaccines. So they're still putting the pieces together for that drive-through. But I think variations of it would certainly happen in different regions. I know Region 2 is also contemplating doing something similar.
Okay. So aside from the drive-through, can you provide us with a general update on the vaccination campaign countrywide?
Overall, I think so far, as of yesterday, we've had 184,319 first dose vaccines, which would be approximately 37.9% of our adult population. And we've had 54,691 second dose people being fully immunized. That would mean that we now have 11.2% of our adult population fully immunized.
Have there been any progress in regions that were lagging, particularly Region 10, because I know that was a problematic area?
Region 10 continues to lag. We have seen an incremental increase. We are now at about 11.3% of the adult population in Region 10, so there's a marginal increase. Hopefully we'll get more people coming out. I saw Mr. Harmon has urged people to get vaccines. So hopefully more people would be attuned to coming out and getting their vaccines. And I want to encourage other leaders to continue to encourage people to come out and get their vaccines. I think it's important that leaders urge people to come out and get vaccines. And those leaders who have not been vaccinated should also take their vaccine, take a photograph of it, post it so that other people can see and to encourage and inspire other people to get their vaccines.
Okay, Minister. I have a question here. It's noted that the age range of between 18 and 40 is also lagging a bit. How do we plan on addressing that?
Well, what we have seen, because in terms of age ranges, we know that the upper age range, that is for 60 and for ages 60 and above, we have been able to do 67.2% of that population. And for the 40 to 59 age group, we are now at 34.9% of that population. For the 39 to 18, we are at 28.9% of that population. So we continue to encourage different population groups to come out and get their vaccines. I think the 67.2% that we have in the older age group was because of the work that we did early on, because we know that older people, persons with comorbidities, were more at risk for COVID-19. And when they do get COVID-19, that they get a more severe form of COVID-19. So that was important to get more of this age group vaccinated. And you would recall when we started our vaccination program that we targeted this group. So that's why they have probably an edge in terms of how many people have been vaccinated. We notice, however, that in this particular group, there have been a slowdown in terms of how many people are coming for their first dose. And we want to encourage older people because you're still at risk. And if you have comorbidities, that you need to come out and get your vaccines. I have seen some people saying, well, I have high blood pressure, can I get my vaccine? Yes, you can, because the vaccines would help to protect you. Persons with heart problems and so forth, diabetes and so forth, they need to come out because that's what we are calling comorbidities. You have underlying conditions that can put you at risk for COVID-19. So in the older age category, while we have a relatively high percentage at 67.2%, we still need to get more people in this age range coming out, and we want to get to as close as possible to about 80-85% of this older age group. And so I want to make that appeal because they are still vulnerable. In the low age group, that is the 39 to 18, when we look at the amount of active cases that we have, within this age range, we see we have more active cases. And this is pointing to people being in this age range, they're probably working, they're out and about, but they get infected. And when they get infected, they can pass the infection on, they can transmit the infections to other people. So we really need to get them to understand that they can be passing this infection along. The challenge that we have is that for most of this age group, they might have milder form of the disease. Although we have been seeing a few cases where some younger people are getting infected coming into the hospital, and we've had a few deaths in the age range between 30 to 40. We've had a few deaths. And therefore, we want people to also understand that they need to come out and get their vaccines as well. And we want to urge them to make use of the opportunity, because vaccines are available throughout the country if they can come out and get their vaccines so that they can protect themselves.
Minister, as we are on the topic of confirmed cases, and as my last question for today, can you give us an update on the status of our ICU at Ocean View?
So right now in our hospitals, we have about 96 persons in hospital. We have 11 persons at the West MRR Hospital. We have 5 at Myconi Hospital. We have another 5 between Skeldon and New Amsterdam Hospital. We have 4 in Bartica, 1 in Madia, and 5 in the Upper Demerara, that's Linden Hospital. We have 64 at Ocean View, with 19 of those persons in the ICU. For the patients in the regions, we have been monitoring them closely, and I think my understanding is that a few of those patients would be discharged during today because their conditions are now stable. So a few of them would be discharged today. At Ocean View, we continue to see the more severe form of COVID because when some of the other places think that these persons are in a severe condition, they will send them down to Ocean View. So currently we have 19 persons in the ICU, and we continue to monitor them.
Thank you so much for that, Minister, and thank you for your time today. This has been our COVID-19 update. For more information, visit our website at dpi.gov.gy or our social media platforms.